Hello everyone, this is NainaMD, Fusion of Science and Beauty, and welcome to my show today where I bring the best in anti-aging and regenerative medicine. I have today a guest with me who is phenomenal. His name is Dr. Peter Fields. He's a medical physician and a chiropractor. He's well practiced over 20 years in the Santa Monica area, has a fabulous practice, and he's here today to discuss what's the latest, greatest in regenerative medicine.
Well, thank you very much for having me on the show.
Welcome to the show.
Thank you.
What I wanted really the audience to understand, number one, what is regenerative medicine, okay? And what is, you do a lot of what we call non-surgical orthopedic medicine. Mm-hmm. What is that? And you know, how is that, what I would say is cutting edge? Tell me some of the cutting edge things that you're doing.
Okay, well, first of all, thank you very much for having me here. And
absolutely.
In a nutshell, regenerative medicine is getting the person's own body to regenerate what has been weakened, torn, or damaged. Right. Okay, ligaments and tendons control joints, and when they get weakened, torn, and damaged, there is a surgical procedure for cutting them or taking them out. Also, cutting up a meniscus or a labrum, such as in a shoulder or in a knee, and even replacing or cutting out joints and doing a total joint replacement. So, regenerative medicine is injecting natural substances into the body to get the body to regenerate itself. And there's three parts of regenerative medicine, or at least the basic regenerative medicine. There's dextrose prolotherapy, where we inject dextrose into the damaged, weakened, damaged.
And that's kind of like a sugar?
That's sugar. Dextrose, exactly. Dextrose, glucose, sugar water.
Right.
And that causes the body to send white cells and platelets to the damaged areas to start a proliferation or regeneration. That's why it's called prolotherapy, proliferation or regeneration. When they're more severely damaged, such as a ligament and tendon, or you have a meniscal tear, or you have a labral tear, you need more concentrated platelets. So we pull blood out of the person's own body, and we spin that down, and that is called PRP, which is commonly in the news now, such with Kobe Bryant and Tiger Woods and things like that.
Doing it, right? Everyone's doing the PRP.
Because they have torn meniscus, and then we inject that back in, where you get 7 to 10 times the amount of platelets, therefore the amount of growth factor.
Yes, so basically the platelets have the growth factors which signal the body to start its own healing process.
Exactly,
right?
And this is more concentrated when the ligaments and tendons are severely damaged, or there's a meniscus or a labral tear. A lot of times it's just the dextrose. Now, taking it way, way past that, there is something called stem cell. Now, stem cell is in the news. They do stem cells for a lot of things.
Exactly.
They do it for,
and it's also very controversial when taken out of context, right?
Exactly.
Yeah.
I mean, they do it in aesthetic medicine. I
think it's important to say these are not stem cells that are fetal cell derived. These are stem cells that are either from your own or...
No, they're from your own, exactly. They're not fetal stem cells. We're not growing body parts, which is done in some things. We're not doing it. We're only doing it in joints, okay?
And they're your own body.
They're the own body.
Right.
And I do what is considered the gold standard. So I use stem cells that I extract from the bone marrow and from the fat. The bone marrow has a great line. It's one line of what we call progenitor cells, very concentrated, but the fat has multiple different lines, so you get a lot of different of these progenitor or stem cells. We combine those, inject that back into the joint, which is usually very worn down, severely arthritic, no more cartilage, bone on bone, or they've been told to have their joint replaced.
I love the fact that you do both, because there's always sometimes a controversy about, okay, let's, we've got, some group of doctors, which, there's some of the same conferences we go to, doing from fat derived and bone marrow derived, and you combine both, so you're giving the best.
Well, actually, I do all 4 kinds, and that's considered the gold standard. So not only do I combine the bone and the fat stem cells, but then I use the PRP as an accelerator to get them to grow faster.
Factors, right? Because you've got the growth factors.
Exactly. And then I use the dextrose,
which is a prolotherapy,
to the outside of the joint, because if you fix the inside, the outside also has to be strengthened. So using all 4 of those is considered the gold standard. And as you said, there are many doctors out there. Sometimes they just do one or they do another.
And they don't combine.
I don't want to take the shortcuts. I want to do what is the absolute best.
And it takes time. It takes a lot of time to do all, by the way, because those are almost like 4 different procedures.
So the 4 procedures, basically, as we explained, were extracting stem cells from bone marrow, extracting it from fat, taking blood and spinning it down, and then using the dextrose.
Right.
These 4 procedures, when the person comes to the office, is about a 4-hour procedure. The patients are obviously prepped. There's no general anesthetic, so there's no worries about any of the anesthesia problems.
Right.
Everything's done under a local anesthetic, and it takes the patient about 4 hours. Now, the good thing about this, if they are a candidate, which is only ascertained after we do a full exam, which is 30 to 40 minutes, this procedure in 85% or greater of the cases only has to be done one time. So I have patients come, they can come from locally, they can come from Seattle, from Vegas, and I even have them come from out of the country because once it's done, stem cells, as you alluded to, take a while. They have to double. We start with 10, 20, 40, 80. So it'll take 3 to 4 months before they feel it. But then after 3, 4 months, they start to feel it. And like I said, we've had results before. I've had patients who are doing extremely well. I will tell you about one patient that I had, and he walked into my office on a cane. He was 68 years old. He looked at me saying, "They want to cut off my knee." And I said, "Really?" He goes, "They said I need a knee replacement. I ski, I surf, I rollerblade."
He's very athletic.
And this guy was on a cane, hobbling into my office. I examined him. I told him he was an excellent candidate. That was last March. And last November, he came into my office, said he just came back from Nicaragua surfing for an entire week with people half his age. He never felt like he had a problem. He carries surfboards to the beach, and he went skiing this past winter.
It's incredible because it's your own body again. It's your own body.
It's his own body.
And that's where it's just like nothing foreign.
And there was nothing to lose. He said, "Listen, I have nothing to lose." He even said, you can see the video on my website under testimonials, he said, "I was skeptical, but boy, am I so glad I did this because once surgery is done, it can't be undone. And 50% of surgeries have a bad outcome."
I think what's happening is people who do things properly and who do things just the right way and everything, it's getting muddled because they hear just terms, right? Stem cells. So it's gotten such a negative connotation, just like anti-aging or regenerative medicine.
Absolutely.
Right? So that's the whole purpose of my show, is to say, look, let's take all the quackery out of it, bring in the credibility, because there's so much evidence base to it, and actually have doctors as yourself that are doing these treatments, having tremendous success and getting the word out, right?
No, and this is absolutely, and even the
so
FDA,
important.
as long as we take stem cells out and put them back in or reimplant them, as they say, within
It's
24
FDA
hours,
compliant.
completely compliant. We're not
absolutely.
growing them, we're not altering them,
That's why I
we're not
wanted
doing
you to
anything
come on
to do
and
that. And we're getting very, very happy people doing that. So
No, I know, this is amazing.
It's a tremendous result.
And you're known as the athletic doc. I know, because I have to ask you, have to tell the audience this, because you walk the talk. Okay, this is the one thing that I was surprised when we go to the same conferences we lecture, right?
Yes.
And I did not know this about you until last year. You are the athletic doc. So please tell the audience what that is.
Well, thank you very much. I really appreciate that. Yes, and I am known as the athletic doc. My passion is triathlons. Actually, I do long distance triathlons, which are Ironman triathlons.
Oh my gosh.
I just completed my 5th one in Brazil, actually this past May 30th. And for those who don't know, an Ironman triathlon is 2.4 mile swim, and then a 112 mile bicycle ride, and then you run a full marathon, which is 26.2 miles. Takes me anywhere from 13 to 14 hours, but it's all about staying in the game, believing in yourself, training, and walking my talk. And by the way, for those who are interested, 14 years ago, I was told by 3 neurosurgeons that if I did not have surgery on my low back, that I would never do athletics again. And each individual one, separate from each other, told me that. I didn't believe in it. I found out about these techniques. I got treated by these techniques. And now I'm one of the lead educators on this, and I thoroughly, obviously believe in it because my back was saved, and if I can save anyone else's back, knee, shoulder, elbow, or hip, then I was just as happy. But they don't have to do Ironman. They can just go. They can just go for a walk, or play with their grandkids, or go to the beach. But whatever it is, don't give up hope. There's always a way. There's always something that you can do to keep you going without having surgery people, right? And doing a lot of drugs.
It's about empowering the audience. I want the audience to get so educated that they demand.
Absolutely. They need to look. You have to think outside the box. If you think outside the box, you'll start investigating non-surgical or alternative medicines like with your practice, and they'll find people like us who can help them without injuring them.
And I think so important is just that the whole piece, everything fits. It's like when you talk about stem cells, then the hormones are important because then they prolong
absolutely.
The stem
having
cells.
A balanced body, having people in good health, will help them heal tremendously, whether it's weight loss, hormones, anything like that.
So it's not just one answer, right? Everyone wants this one answer, and it's not just the one answer. It's the whole picture. It's everything together.
Taking care of oneself, absolutely.
Yeah. So listen, how do people find out about you? I mean, where can they
Well,
look
obviously
you up?
they could call you, but yes.
Absolutely.
My office is located in Santa Monica, California. My website is my name, which is Dr. Fields, and that's drfields.com. I'm on the web. My phone number is an easy phone number. I picked it myself. It's 310-453-1234.
Okay, how easy is that?
So how easy is that? 453-1234 in the 310 area code, or drfields.com. If they write in, I will answer anybody's question. You mentioned, I saw you on the doctor's show here, and believe me, you'll get a personal phone call from either me or my director of operations.
No, that's amazing. Again, I want to thank you because I know you took time out just to drive all the way here. You got in the midst of patients. Because you believe so much in this, right?
Well, obviously, an educated patient and consumer is the best thing. We want people who ask questions, who know. I'm sure in your practice too.
Absolutely.
And these patients, when they're inquiring, they're asking.
And most of my patients are actually coming to me, telling me, "Look, I've been looking for the best hormone doctor, or I've been looking for this, or I've been looking for this IV therapy doctor, or whatever." They are educated, you know. And that's the more people we get educated, they will demand and then ultimately change the healthcare system.
Absolutely,
right?
because the more people who demand things and the more things, it may be slow, but at least they're in the forefront now, as I said, seeing you or seeing me, and they know they're getting the best natural care.
Yeah, and it's not natural, but I call it a step further than natural care. It is actually the most cutting edge. It's what we call
absolutely cutting edge.
biologics. We're in the age of biologics, right?
Whether it's hormones, whether it's stem cells, whether it's PRP, we're working with the person's own body to help. I always say to people, I'm going to help you to heal yourself. We're not doing it alone. Everybody has to help. The patient, the doctor, and when it's a team like that, it'll work really well.
Thank you so much, really, for coming on my show.
All right, well, thank you very much for having me.
You're coming back, yes?
I will absolutely come back.
Okay,
all right. Take care.
Thank you, everyone. This is NainaMD, Fusion of Science and Beauty. I'll be right back with my next guest.